We're going to draw up this morphine, making sure not to touch the sides, so we don't want to contaminate the needle. Okay. Go over to a sink. We call another nurse over. Show this is morphine, 2 milliliters. It's empty. We could put that in sharps, and then I'd show here we have 2 mils of morphine. Ask the nurse to come over. Watch me waste until we are at 1.5 mils. And then I have verify. I don't know if you can see it. You good?
Good.
So we got 1.5 mils. Take the needle, recap it with the filter needle. We take the filter needle off, put it in sharps, and then take our regular needle. Garbage. Okay, now that we have the medication ready, we go to the patient. Okay, Miss Jones, we're going to administer this morphine. It's an IM shot, so it's intramuscular. It either we need to go into the deltoid, the ventral gluteal, or the vastus lateralis. And we try and not do it in the dorsal gluteal because of risk at hitting the sciatic nerve. But we're going to do this in the ventral gluteal, have them go on their side. To measure those sites, I forgot to do so. We're going to set this morphine down for just now. You would go at the top of the shoulder here, put your hand, two fingers, and then the third one you would open up, and it would be right in that spot, right in the middle. So that's for the deltoid, and then I'll demonstrate on the mannequin real quick. On the mannequin for their ventral gluteal, we have them on their side. You go at the hip bone. You put your hand lengthwise with the hand pointing in towards the groin area, and then you separate these 2 fingers at first, and it's right there. And then the vastus lateralis is a hand breath here and a hand breath there, and anywhere on that side of the leg. So cover Miss Jones back up, and then I'm going to demonstrate on the injected pad here for the morphine. We take out our cotton swab, clean from center out, letting air dry, discard that in the garbage, letting air dry, waiting for that to air dry, push open the release, and then we're going to take the cap off. We can put that in garbage as well. After it is dried, we are using the Z-track method with the non-dominant hand not to put on the site that you cleaned. You're going to track that back, and then like a dart. Okay, Miss Jones, on the count of 3. Ready? 1, 2, 3. Aspirate. If no blood, then we can administer the drug. Slowly pushing the drug in. After pushing in, we would hold for 10 seconds, and then after 10 seconds, we would release at the same time, pulling up, straight out. after that, and a cap, and then we would put that in sharps. I forgot to mention, on the deltoid you can administer up to 1 ml of medication. On the other 2 sites, you can administer up to 3 ml. You do not aspirate on the deltoid, but the other sites you do aspirate. Now for the Carpijet, I'm just going to demonstrate it. You go about the same process administering it, assessing for pain. But for the Carpijet, we insert it in, make sure your mils are out where you can see them and know how much you have. You twist this little guy on, you got a little metal screw in there. You take it, twist that on to lock it in place. It's not coming out now, unless you really jar it. But it's ready now. You have the, twisted. You have the mils there. You go over to the sink, ask it, there's come over, watch you waste it. After you waste it, you have it ready, clean the site, and inject. But we already demonstrated the ampule. And then you'd put it in sharps. So now that we have done that, after we had administered the morphine, we make sure, Ms. Jones, we're going to come back and check in a half an hour for that pain. See if the medication has been onset, and see how it's performing, okay? Next, we're going to do ampicillin. I'm going to pull out all of our items here. Okay. First off, we're going to take medications. We're going to look at our MAR, again checking it for the 3rd time. Make sure we have the right medication, the right dose, right route, which is IM again, and expiration date is good. We are going to use, there's 3 different medications here. We're going to choose up which one to use. Looks like we're going to use the middle one. We're going to draw up 7.1 mils. I'm going to circle that. And then initial and date it. Today is the 20th? 21st? Sure. And date it like that. After I've done so, I'm going to take out our 10 mil syringe here. We need a bigger syringe at first to mix the solution. We're going to take our filter needle. Oh, excuse me. Ooh, sorry. First off, we're going to pop these caps. I should have done this first. I'm sorry. And we're going to take an alcohol swab and swab these. Letting those air dry. And then from that point, we're going to pull that out. We're going to draw up 7.1 mils of air. We're going to inject that in there. And then we're going to draw up 7.1 mils of water. Sorry. sure to get the air bubbles. Okay. Going straight out and then straight into our powder here. Make sure we recap that. We take the filter needle off, put that in sharps. And then take out our smaller syringe and put that on there because that's what we're going to be using next. The diluent we're going to roll in our hand for 10 seconds or 8 to 10 times. Careful not to shake. We don't want to get air bubbles or things in them. We just want to roll it. Okay, after doing so, we're ready for our medication, ready to draw it up. We needed to configure this medication, and here's the configuring. And we're going to drop 0.9 mils of this medication, ampicillin. Okay. Still using the filter needle. We're going to put in our needle in our empty syringe, 0.9. Get that in. Making sure the needle is down in the fluid. Air bubbles again. That looks about that looks correct. 0.9 mils. Now at that point, we are going to take out our filter needle, and we're going to use our regular needle. Okay, now that we have it ready, we're ready to administer. I'm going to set that down for now. Ms. Jones, we have your ampicillin ready. Before we give your ampicillin, do you know what your ampicillin is for? Yeah, you don't. It's for your infection that is in your lungs. But before we give it, we want to make sure, are you allergic to ampicillin or penicillin? Is another name for it, or it has that drug in it. So if you're allergic, we can't give this to you. Are you allergic to that med? You are not. Okay. So we're ready to administer. We're doing it IM just like demonstrated on the other site. So we're going to pull back. Sorry. First off, we're going to clean the area from the middle, the small circles outwards, letting air dry. We put any leftover medications back in the med car for future use, if need be. Okay, after it's air dried, take the cap off, put that in the sharps or the garbage. We would Z-tract, use the Z-tract method, not to put our hand on top of the site, pulling back with our non-dominant hand like a dart. Okay, Miss Jones, on the count of 3, you're going to insert this needle. Okay, 1, 2, 3. Aspirate. Make sure that we don't have any blood. As we don't have any blood, then we slowly push the med. After pushing, holding it there for 10 seconds. After the 10 seconds, we release at the same time. And then put that in sharp.